When we first started to work on readmissions about 3 years ago, we really didn't understand the problem at all. We thought it would be simple to fix.
We've realized that there are so many pieces of the puzzle that need to be put together to make sure that a patient has a safe transition once they leave the hospital.
One of the biggest challenges providers face in avoiding readmissions is that they're working in a domain of unbelievable complexity.
I mean, we provide so much information to the patients. It's hard for a young, healthy patient to get it all, let alone an elderly patient who's sick, and they just want to go home.
I think this kind of work has required folks to actually have new partnerships, new collaborations, and make new friends, to be honest with you, because your goals are the same.
Providers like hospitals, nursing homes, home health agencies, hospice, assisted living, community-based organizations, all of these organizations need to work with the patients to ensure that they have a smooth transition. They all need to communicate together to ensure that a patient doesn't go back to the hospital inappropriately.
The best practices we've seen are for IPAs and medical groups to create teams where they can see the patient very quickly as they're exiting the hospital. They can spend enough time with them to make sure they understand their medications, understand how they can take care of themselves.
I never realized that working as a nurse practitioner with other nurse practitioners, I was missing the value added and the different perspectives that disciplines like social work and pharmacy can add.
Getting these cross-continuum teams comprised of medical providers from different segments of the care continuum was really powerful, but it got even more powerful when we engaged community services and community support organizations as well.
It's really once you get that entire view of the care continuum from the patient's view, can you really begin to make a difference.
I like the ant program where the ant just takes one little piece of sand and moves it in the ant farm until after a day or so they've actually made a big tunnel in the ant farm. That's kind of what communities need to do. Don't chew off too much, take a little bit at a time and be persistent. And the payoff is tremendous.
There's a lot of tools out there, but I tell you there's no substitute for just getting people in the room to express a mutual intention to work together on this issue.
I think that with the multiple priorities that we have in the hospitals today, our most important priorities are really about our patients.
I think the role of patients and families is huge in preventing readmissions. I think that education is the main way that we're going to accomplish that.
Our patients trust and depend upon us for their care. And our patients are not passive recipients of health care. They are active parts of the healthcare system.
California has achieved tremendous progress in reducing readmissions. And if you look at the population-based measure, readmissions per thousand, from calendar year 2010 to 2012, California has achieved approximately 9 to 10% relative improvement in reducing readmissions. And that translates into 16,200 averted readmissions. So if you look at the average cost of a readmission in California, it's $15,000. So if you multiply 15,000 by 16,200 averted readmissions, we have saved Medicare $243 million.
This ability to really impact people's lives in a meaningful way has never been greater, and it's the environment that we're working in now, so it's exciting.